Good morning. I'm Lize Havemann-Nel from the Center of Excellence for Nutrition at Northwest University. I'm also the local project coordinator for the ImpENSA Project for the South African partners. And I'm going to give you a brief overview of the ImpENSA Project. So ImpENSA stands for Improving Early Nutrition and Health in South Africa. So ImpENSA is a capacity building project co-funded by the Erasmus Plus program of the European Union. And it's really capacity building to improve early nutrition and health in South Africa. The ImpENSA team consists of consortium members from 6 higher education institutions, of which 3 are from South Africa and 3 are from Europe, as well as 2 health professional associations in South Africa. The 3 South African universities include Northwest University, the University of Stellenbosch, the University of Cape Town, and then the European universities are the Ludwig Maximilians University in Munich, the University of Southampton in the UK, and then the Medical University of Warsaw in Poland. And then there are 2 health professional associations that are part of the team are ATSA, the Association for Dietitians in South Africa, and the Nutrition Society of South Africa, or NSSA. So I'm not going to introduce all the members individually, but I would like to share this very nice photograph taken in front of Red Cross Hospital in Cape Town earlier this year when we had our 3rd biennial meeting. And as you can see, there's quite a number of individuals involved in the ImpENSA project, and we really have individuals of all over the world that are in some way involved in the ImpENSA project. So the overall aim of ImpENSA is to strengthen relations between higher education, so that's the higher education institutions or the universities, and the wider economic and social environment through exchange of state-of-the-art practices for co-creation of an innovative training course that facilitates continued professional development for healthcare professionals in South Africa. So really the product of the ImpENSA project is the ImpENSA training program. So this program will then be compiled by universities and rolled out to the end users to make a difference where it's most needed. So this training program is a blended training program, and the focus will specifically be on micronutrient nutrition during the first 1,000 days of life. So blended implies that this program combines online learning or e-learning with face-to-face learning. So the program consists of 2 modules, online e-learning modules, the one optimizing micronutrient nutrition during the first 1,000 days. Module 2 is communication to support behavior change. And then the face-to-face component, that's module 3, is healthy conversation skills to support behavior change. So the initial target users of the ImpENSA training program are South African healthcare professionals, including dietitians, nutritionists, nurses, midwives, pharmacists, medical doctors, including your general practitioners, your pediatricians, and specifically also your gynecologists. So it's really any of the healthcare professionals who's working in the first 1,000 days. So the project initially was awarded a 3-year project lifetime, but was recently extended due to COVID with an additional 12 months. And the project consists of 6 work packages. Work package 1 was a training landscape analysis, which we've already completed last year. So before we can develop a new training program, it's obviously good to know what's in place currently and how can the new program fill the gaps. Then work package 2, 3, and 4, those are the development packages. So work package 2 we've also just recently completed, and that entails the module content development. Then work package 3 is then implementing the content on an e-learning platform. Work package 4 is implementation and piloting of the ImpENSA training program. Work package 5 is monitoring and evaluation of the entire process. And then work package 6 involves dissemination, exploitation, and sustainability. Because after the 3 to 4 year project lifetime, we would obviously like to continue rolling out this training program. In order to sustain it, we need a business plan and a social enterprise in place. So what's next? So once the modules are in place and we've implemented the training program, before we can enroll the training program, pilot it, we first need to train a number of additional trainers to actually implement this program. So that's why you will see a separate fourth module on the slide there. So we will start, or one of our master trainers from the UK, and you will meet a little bit later in one of the presentations, Dr. Wendy Lawrence from Southampton. She will come and physically train a few new trainers to train then other healthcare professionals. And then these newly trained trainers will pilot the ImpENSA program. And that's part of work package 4, the implementation and piloting. And then part of this will also be obviously evaluation, which forms part of work package 5. So the newly trained trainers will not only pilot the ImpENSA training in an in-house setting, but they will also take this program to more rural areas via a mobile setup. And in that way, we are really also aiming to reach more healthcare professionals in more remote areas. Yeah, so this is just in a nutshell a broad overview of the ImpENSA project. So the two speakers that will follow will then provide more insight into the modules, module 1 and 2, the e-learning modules, but also give you a bit of a taste what the healthy conversation skills to support behavior change entails. Thank you very much.